Hi everyone, welcome back. Today I am going to be talking about how massage can help with torticollis, which is otherwise known as wry neck or neck dystonia. Now, obviously, a lot of people who come for a massage will say that they feel tension in their neck and shoulders. That's quite common. But torticollis is actually a painful flexion or extension or twisting and tilting of the neck beyond its normal position, which causes the head to tilt to one side. Now, it can be congenital or acquired, often due to, damage of the neck muscles or potentially even the blood vessels in the neck. And while it may be temporary, the chances of reoccurrence once you've had it are, really quite high. And the stiffness and debilitating pain can make performing just those simple daily activities, really quite difficult. So it's really important to get treatment for this as soon as possible. Now, there are different types of torticollis. There is acute or fixed torticollis, which is usually due to a problem with the muscular or bone structure, but it can be caused by twisting the neck too far, which creates pain when moving the head to the opposite side, thus restricting movement. This type of torticollis will cause you to hold your head either straight or rotated to one side. And the neck muscles on the affected side that hurts are often, quite tender to touch. Then you have muscular torticollis, which is the most common type of fixed torticollis, usually caused by scarring or tight muscles on one side of the neck. That could be caused by sleeping in a funny position or work, whatever. Then we have cervical dystonia, otherwise known as spasmodic torticollis, which this one occurs due to family history, and it's where involuntary contractions of the neck muscles leads to sort of a spasmodic twisting of the neck and awkward posture of the head and neck. This usually begins sort of between 31 and 50 years of age, and it can become permanent if untreated. So again, prompt treatment is really important. And as I say, this is sometimes referred to as spasmodic torticollis because of the spasms that, that occur in the muscles. Now, if you have cervical or spasmodic dystonia, your head will twist or turn painfully to one side. It may also tilt forwards or backwards. Cervical dystonia is sometimes will go away without treatment, but there is a risk of recurrence. And it can really happen to anyone, but it is, probably most commonly diagnosed in people who are sort of, between 40 and 60 years old. And it does tend to affect, more women than men. So whether there is some sort of hormonal aspect to this, possibly could explain, why that happens. Then we have something called temporary torticollis, which usually lasts just 1 or 2 days. And this can be due to a cold or swollen lymph nodes, an ear infection, or some sort of head and neck injury, that involves inflammation. Again, maybe, due to sort of a poor sleeping position. But that usually, tends to kind of subside pretty much by itself. You can do a few sort of neck stretches yourself, maybe some heat on it to relax the muscles, and that will probably sort it out. Now, there is also a very rare congenital form of torticollis, which is called Klippel-Feil syndrome. Now, this occurs due to the bones in a baby's neck not developing correctly, and it means that two neck vertebrae will be fused together, which may also cause hearing and visual problems. Then another one that occurs in infancy is benign paroxysmal torticollis, otherwise known as BPTI, and the I standing for infancy. This again is rare and characterized by recurrent episodes of tilting the head to one side. So, torticollis, it's usually temporary, and it can be treated if caused by illness or injury, whereas the two congenital forms that I've just mentioned can cause swollen neck muscles, chronic pain, neurological symptoms from nerve compression, difficulty in performing basic activities, also inability to drive, when they're older, difficulty socializing, and isolation. So there's quite a few, ways that this can really, affect your life moving forward. And obviously, as with, any kind of chronic health issue, depression is also, another common symptom. Now, there is a higher success rate of treatment in congenital forms if the treatment is done as an infant. So again, the sooner the better is really, the way to go. So if we look at risk factors for torticollis and causes, as we've mentioned, there can be a genetic link. Also, with congenital forms, if the baby's head is in the wrong position in the womb, sometimes, for example, and it's rare, but, as a midwife, I know occasionally you may get a face presentation, so where the baby would be head down, but instead of sort of the crown of the head being down and engaging, with the cervix, it would actually be that the head is kind of pulled back and the face would be what would meet with the cervix first. This puts an awful lot of pressure on the neck, and you wouldn't have a natural delivery in these cases. It would be a cesarean section. But also any other kind of trauma during childbirth. So that could be something like if you have to have a forceps delivery, that can be quite traumatic, both on mother and potentially on baby too. With congenital muscular torticollis, postural physical deformity tends to be present at birth due to shortened or scarred sternocleidomastoid muscle on one side of the neck. So that's when you twist and you see this big muscle on either side, that is your sternocleidomastoid muscle. So it literally goes from the mastoid process behind the ear down. One branch goes down to the sternum, which is your breastbone, and the other branch comes off onto the clavicle, which is the collarbone. Also, sleeping with the head in the same position often, as we say, accompanies muscular torticollis. Trauma to the muscles, nerves, or blood vessels in the neck or spine can also be a cause of torticollis. So that could be something even like whiplash injuries, if you're in a car accident. Infection of the head and neck, inflammatory torticollis, where muscles overlying lymph nodes may contract. And if this is associated with abscesses in the throat, this can be life-threatening, because obviously if the muscles around there contract, you're looking at things like the airway closing off, which can be fatal. Adverse reactions to medication. So an example of this would be neuroleptic drugs. So things like prochlorperazine, haloperidol, chlorpromazine. These can cause a lack of normal muscle control. Also drug abuse, so using things like ketamine, amphetamines, cocaine, these can also, put you at high risk of torticollis. Other medical conditions as well, so things like tumours, scar tissue, arthritis, or particularly of the cervical spine, or any kind of vascular abnormalities. All these things can cause damage to either the muscle tissue or to the blood vessels. But in a lot of cases, the cause is often unknown, and this would be referred to as idiopathic torticollis. So in terms of symptoms, how do we recognise something as being torticollis? The symptoms, may progress slowly and worsen over time. But certainly it will involve things like an inability to move your head normally, neck, shoulder, possibly upper back pain, stiffness. Sometimes there may be a burning sensation. And quite often this happens if there's nerve compression as well. One shoulder may be higher than the other. And the neck muscles, particularly that sternocleidomastoid muscle that we talked about, may be swollen. You may also experience headaches. The head will tend to be, turned to one side, sometimes with tilting of the chin, neck muscle spasms that may be what we call tonic, which means that they're sustained spasms, or they may be more jerky, which is referred to as clonic. There may be deviation of the eyes, which is called oculogyric crisis, or protrusion of the tongue, which is referred to as a bucolingual crisis. In benign paroxysmal torticollis in infants, you can also see vomiting, general irritability, and also sometimes drowsiness. And in congenital forms, quite often there may be a flattened or unbalanced facial appearance. And there may be, and again, that may be due to, the position in the womb. And there will also be motor skill delays, or, as we've said, hearing or visual impairment of some kind. So, in terms of seeking medical attention, in rare occasions, certain things may apply, and these are the things that will require emergency, medical care. So this will be things like if there is trouble breathing or swallowing. So again, if there's been any, as we've said, sort of something like a throat abscess, this is something to watch out for. Numbness in your arms and legs, which would indicate severe nerve compression. Urinary hesitancy, or urinary or fecal incontinence, again, could be due to, some sort of severe nerve compression. Weakness in the arms and legs, difficulty walking, spasm of those neck muscles, which may be associated with fever, swollen glands, headache, neck stiffness, or tongue swelling, or problems with swallowing. And also there may be, particularly if the tongue is affected, there may be impaired speech. Treatment itself, as I said, is most successful if started early, especially in pediatric cases. And the aim is to relax those contracted neck muscles. And generally it will resolve, quite often in a few days, to a few weeks. Some will continue to have neck problems for months to years. But, if you get in there early and have regular treatment, then, in most cases, it should, pretty much resolve it. Application of heat, again, to, relax those neck muscles will really help. And certainly if that heat application is done, alongside massage, physiotherapy, traction, stretching exercises, possibly neck braces. There may be medication, such as muscle relaxants, antispasmodic medication, possibly Botox injections repeated every few months, or pain medication. Certainly if you use heat alongside this, then, that's only going to sort of further, improve the condition. Now, in some cases, surgery may be used. Obviously, if it's one of the congenital forms, certainly where there are two fused vertebrae in the neck, it may be used to lengthen the neck muscles or potentially cut nerves or muscles. Also, deep brain stimulation to interrupt the nerve signals may be used, but again, this is really only in severe cases of cervical dystonia. In terms of what you can do at home, just to offer, temporary relief, it's suggested that lying on your back will help, because symptoms will often disappear during sleep. And obviously, if you're lying on your back, then your neck doesn't tend to be sort of in one of those awkward positions. But also it's been suggested that if you touch your face, on the opposite side of the muscle that's affected. So if it's this side of the muscle that's affected, it's suggested that if you touch your face on this side or on the chin or around the neck, it can trick your brain into stopping those spasms temporarily. Applying heat, as we've said, to loosen tight muscles. Passive stretching in infants, so that's where obviously you would sort of provide the resistance, and where the person who's affected doesn't do any of the work. Stress reduction techniques, because as with many things, stress can worsen the symptoms. Neck exercises as recommended by either a physio or a sports therapist. And also, if it's an older baby as well, facilitating active movements by using sights or sounds to get a child to turn their head in a certain direction. And that can be done easily sort of through play. Now, in terms of massage therapy, one of the most effective treatments for torticollis, this will certainly help relieve painful muscle spasms in the neck and really just relax and stretch the contracted muscle, which will also in turn relieve any pressure on the nerves that are compressed by a tight muscle. Consequently avoiding impingement of the nerves in the neck, which can lead to numbness and tingling in the arm or hand on the affected side, and this will be seen in chronic cases. Massage can be used to treat any torticollis which is not due to a cervical tumour, abscess, infected tonsils, herniated cervical disc, or neurological disorders. Those issues, should not be treated with massage. Now, as far as the massage treatment itself goes, it may involve heat. That can certainly help to relax the muscles further and prolong the effect of the massage. It may involve gentle massage, traction, or passive stretching. I say gentle massage because, the neck area can be extremely sensitive, under normal conditions. And obviously when you've got torticollis, even more so. The treatment will predominantly work on stretching and mobilizing of that sternocleidomastoid muscle, which turns and tilts the head. The goal really is to relax the superficial tissues first, and then gradually work, deeper into that sternocleidomastoid muscle, using the fingertips, possibly the knuckles or the palm, to stretch the muscle lengthwise and crosswise, but being careful, of course, that the carotid artery is not pressed at any point. As the neck muscles relax, there will then be attempts to move the neck in its full range of motion, and applying gentle traction to stretch the muscle fibers and holding that position, for a few seconds. Also contracting the muscle against resistance may also provide an opportunity to stretch it further upon, relaxing the muscle. Once the muscles are more relaxed, then the therapist would look if they're qualified in this, they would look for trigger points, which are basically tightened nodules of muscle fibre, and usually they are the most painful spots in the muscle. But by pressing these trigger points, it will help them to relax. And I would say, if you are suffering from torticollis, look for a sports therapist who is trained in trigger point therapy, because that will give you the most effective treatment. Alternating hot and cold packs for 10 minutes at a time, following the massage, will help work on both inflammation and relaxing those muscles. And doing gentle stretching exercises, which a sports therapist should be able to recommend to you, will help just to keep, the muscle relaxed further. So that's really, the best way of dealing with this issue. As I say, do make sure that you see a qualified therapist, who knows what they're doing, who knows about the blood vessels of the neck, who knows trigger points, and that will really work in your favour. As always, feel free to comment down below. You can subscribe to my channel. I will actually be doing some videos on trigger points in the future, so you'll be notified when they come up. Alternatively, you can contact me through my Facebook or Instagram profiles, and I will answer you. So if you've got any queries, don't hesitate to contact me. But for now, that is really it from me. So take care, and I will see you next time. Bye.